Okay, so you can pass, Carly. So the first thing that I would like to say all the time, and again, I'm going to repeat myself, saying that a lot of the concerns that comes when we have a new diagnosis of breast cancer or any other type of cancer is, could I have prevented this, or is this my diet who caused this? And the answer, the clear answer, is no. To get cancer, there's a lot of, it's multifactorial, so a lot of factors that might play a role. And diet has an indirect relation with cancer. So there's studies that prove that some patterns may increase the risk. However, it's not proven to be the only and unique producer of the cancer. So when we go and talk about diet and nutrition and healthy lifestyle, what are those factors that have actually been proven to have an effect in increased risk of the diagnosis of breast cancer? So there's 4. And out of those 4, I would say they go a little bit in cycles. So one may lead to the other. And then we don't know who itself is the major factor that is going to increase risk, or is maybe a little bit of everything. So we do know, specifically on breast cancer, that overweight or increased weight may lead to a higher risk or a high percentage to develop a cancer in your life. We do know that saturated fats are mostly coming from either animal sources or vegetables oils that are modified, and they become either trans or saturated. And then again, usually when we have a high consumption of saturated fats, then we have the tendency to maybe have a little bit overweight, a little bit of excess, and then we don't know which one is the one who created. Then we have the alcohol. The alcohol has been related as well with an increase by itself on breast cancer. And then we go, can I drink alcohol? And you're gonna see it maybe further in the presentation, but when we talk about nutrition, we're talking about, or what we recommend is a balance, is like, we don't wanna restrain, we don't wanna be too restrictive with some things. It's just, and it should be try to do better choices and do not go on excess. So in terms of alcohol, all alcohols has been related with increase of breast cancer. However, then we have the red wine that has some benefits in terms of antioxidants and flavonoids. So this is why we don't want to be like black and white. So everything that's bad, we remove, everything that's good, we increase, and everything becomes a matter of balance. And the other factor that has been related with increased risk of breast cancer is the exercise. So it has been proven that sedentary people or people less active may develop in higher numbers breast cancer. And then we go back again, is it because sedentary people have the tendency to be more overweight or to have less muscle mass? We don't know, but this is what in reality nutrition wise has been related with an increase in breast cancer diagnosis. You can go, Carly. Okay, so when we talk about nutrition, a balanced nutrition, and we dietitians, we really like the new Canadian food guide, because it really shows what we have been trying to say for years and years and years. And this is not a recommendation particular for breast cancer patients or cancer patients. This is a recommendation for everybody. This is why it's the Canadian food guide, but it goes and goes look for whatever we want to eat or whatever food we want to make part of our daily food habits or daily intake. So if we see to your left, you have a plate. It simulates a plate of what we should eat in a daily basis, especially lunch and supper. So we have half of the all the plates. We have fruit and vegetables, and what we're gonna get with the fruit and vegetables is we're gonna get the variety of micronutrients, things that we have in very, very small quantities, like vitamins, minerals. We also have all the antioxidants. So if we get a variety of colors every day, then we're gonna go and get all the micronutrients that we need. Then on the other side are things that are gonna give a little bit more macronutrients, which is nutrients that we need in higher quantity. So we have, out of the half of the plate, we have a quarter of protein sources. And if you see here, there's like a lot of protein sources that we can choose. For example, fish, meat, soya, egg, milk, dairy products. So all these are protein sources. What is proven concerning cancer is that if we have a higher or a plant-based diet, we could reduce the risk of either having a first cancer or having a recurrence of another type of cancer. So when I say plant-based, again, I'm not saying that we're recommending a vegetarian diet if you like to have your meat or your chicken or your veal. But what we recommend, I'm seeing the question, but what we recommend is just to try and switch a little bit. If you're used to your meat, try to have maybe 1 or twice a week a vegetarian meal, just to try to reduce a little bit the intake of animal sources. And then we have on the other quarter of the plate, we have the carbohydrates. And this is a very common question of patients. Should I have should I follow ketogenic diet, or should I remove the carbs? The carbs and the sugar, they're gonna feed the cancer. So can I eat carbohydrates? Can I eat sugar? And the answer is yes, you can eat sugar. The sugar itself is not gonna make your cancer worse. It's not gonna feed your cancer. However, cancer cells are cells, and our cells, all of our cells in our body are fed mostly with sugar, with the glucose, with the carbohydrates. So what we recommend is just go for carbohydrates that are good quality source, high fiber, refined carbohydrates, less sugar added. So you have the energy that your body in general needs to function, but you don't have the extra sugar that is gonna maybe overgive energy for that cancer cell to grow faster. So again, what is proven to work with decrease or reduce the recurrence of the cancer is a plant-based diet. And when I talk about cancer, I'm not talking just about cancer. It also proven to reduce weight, to reduce risk of cardiovascular diseases or another comorbidity like hypertension, dyslipidemia, metabolic syndrome. So this is like an actual recommendation but made by dietetic associations. What other kind of food has been related directly to cancer? Not specifically with breast cancer, but the red meats and the cold cuts are linked with increased risk of colorectal cancer. So it has been related, these kind of meats, because of the high quantity of nitrates. And also, if you think about composition, I told you earlier that the saturated fats, they're linked as well with the increased risk of cancer. And the red meats, they have the tendency by nature of have a little bit, they give us a little bit extra saturated fat versus another kind of animal sources. Of course, if we're gonna have red meats, again, I'm not recommending to remove, I'm just recommending to decrease the frequency and the quantity, and maybe just try to use substitutes to try to go for more for a plant-based or maybe white meats. And when we do the red meats, just to try to choose the leaner cuts. So the leaner cuts are gonna be lower in saturated fat, and they're gonna just reduce that, that factor. As well, when you're gonna go for red meats, try to keep the portion sizes. So if you're going for, let's say, a supper or a lunch portion, just try to go a little bit with the palm of your hand so you don't go over the quantities. So again, a high fiber diet, it has been related as well with reducing the risk of cancer. And when we look, if we look what is a high fiber diet, again, we go with fresh food, fresh fruits, fresh vegetables. We go with whole wheat carbohydrates, whole wheat cereals. We go with beans. So it takes me back to what is looking like a plant-based diet. Also, it has been related with reducing the risk of or recurrence of cancer, a diet that has enough omega-3. So we all know that omega-3 is antioxidant, so it reduces the inflammation in the body. The omega-3, we don't have necessarily to go and get a pill or a supplement. We can get it from the diet, a lot of nuts, salmon, eggs, avocado. So we can just go and get it naturally. The quantities are not really that high if we try to eat fatty fish at least 2 times a week. Then specifically for the patients having chemotherapy, radiotherapy, hydration becomes very important. Is it important in general? Our body is made out of 70% of water around-ish. So hydration is important for everybody, but especially for patients who are undergoing chemotherapy and radiotherapy, we are giving a lot of toxins with those treatments. So we want you to use urine, like increase your urine output. So you're gonna just remove all those toxins as fast as you can. So then again, what about soy or flax seeds? And I'm very specific with those for all those hormone receptor cancer, breast cancer, that we know that those specifically food items are going to give phytoestrogens. So it has been proven now that if we eat soy products or flaxseed or phytoestrogen food since we're child, so in the childhood, is going to prevent or is going to reduce the risk of any kind of cancer. If we already are diagnosed with the cancer, it has been proven that the soy, the phytoestrogens or the vegetable phytoestrogens that come from food, they don't have the same function in the body that the estrogens that we produce. So they actually compete with the receptor. So what is going to happen is that if you eat soy products, you're going to have less chances that your own estrogens are going to link in your body and they're going to produce, or they're going to reduce the growth of the cell. In terms of alcohol, again, I said it before, the alcohol, when we drink it in excess, is going to be related directly with the increased risk of cancer. And for those who are in hormone therapy, or for those who have high risk of osteoporosis, alcohol is going to decrease the absorption of the calcium in your body. It's going to decrease the absorption, and it's going to make that this calcium is going to have a less binding to the storage in the bones. So it's going to actually increase your risk of osteoporosis. And of course, exercises is going to make us be closer to our ideal body weight or your healthy body weight. It's going to increase the muscle mass and decrease the fat mass, that it might be related with a high risk of cancer. It's going to also strengthen a little bit our bone health. So again, for those people having hormone therapy or having increased risk of osteoporosis, it's going to be beneficial for us. And this is a little bit about bone health, but I don't know if I know there's a lot of questions regarding nutrition, so I'm going to stop here, and then I'm going to allow you to ask before going into bone health. I know that I have a few. I'm gonna just I know that I have a few questions here. Okay. I'm 32 years old, hormone-positive breast cancer in chemotherapy. Have been getting monthly injections since January to maintain induced menopause. Will be doing surgery and start hormone therapy for 5-10 years. How do I maintain my both health, seeing that my body is being asked to do something it would naturally be doing in 25? Okay. So in terms of your hormone replacement, you're going to be induced menopause. So you're going to have all the changes that women go through menopause. So you're going to have your metabolism might decrease. You're going to have high risk of osteoporosis. You're going to have probably a little bit of an exchange of how do you call your body composition is gonna be a little bit higher in fat and less in lean mass, which is the muscle. So this is why from early in the treatment or early, even like early age, we recommend you to increase exercise so you can preserve as much as you can of your muscle mass. When you're going hormone therapy, you're gonna be having, just because the estrogens is a factor that protects the bone, you're going to have increased risk of osteoporosis. So what happened, and this is a little bit the next slide, what happened with the bone is that we have a constant change. So we destroy, we produce, we destroy, we produce. So when we don't have the estrogens that protects our body, the destruction rate or the destruction speed is faster than the construction. So we're going to have more destruction than bone mass. So this is why it's important to do, you have to do a mix of this. Obviously a kinesiologist or a physiotherapist is going to be more entitled to tell you the recommendation, but we recommend to have aerobic and anaerobic exercise just to improve your density of the bone. Of course, if you don't go for diet, like in a healthy diet, you don't get enough vitamin D and calcium supplementation, then you have to go for pills, for medication. And usually the requirements are a little bit high. So for calcium, it's around 1200. Is like when we are like 55 and older. And for vitamin D, is around 800 international units per day. So if it's not harmful. So if you're not sure that you're going to meet your requirements by diet, you can have between 500 and 1500 milligrams of calcium per day, depending on your intake. Alcohol is important, like I said before, not just for the absorption of calcium that is going to be decreased, is also important because if you drink too much, you can lose your balance. You can have higher risk of falls. You can have higher risk of fractures, and so on. So I don't know if I answer everything you want to know, Alex. Alex? I don't know, Carly, can you just let them?
We'll see. We'll see. I don't have an answer from her in the chat, so it looks like maybe
perfect. Good.
Oh, yeah.
Could you repeat, please? Soya and flaxseed is good? Yes, it's good. We do recommend. There's new evidence shows that soya is still a protector factor, or phytoestrogens, which is soya and flaxseed. So we recommend for soya 1 to 3 portions a day. And if the easiest way, we talk about, let's say, a glass of soya milk is 1 portion, 50 grams of tofu is 1 portion. So yes, you're allowed to have soya and flaxseed, and you will have the protective effect for your breast cancer decreased risk. Please repeat your comments regarding soya and flaxseed. Okay, perfect. I did it again. So if you have questions, repost it in the chat. Is it okay to eat chia seeds for those who have positive estrogens? Yes, you can have chia seeds. They have the benefits of the healthy fat content. They have the benefit from the fiber. And usually we recommend not to have more than 2 tablespoons per day of seeds in general as a supplementation.
Okay. Do you want to go through some other questions, Yamileth, or you want to keep going with your presentation?
I don't have, no, the presentation is over. Like
okay.
there's nothing, there's just questions. I had
questions by email
yes.
initially, so I can bring them up now and see if maybe we've already answered them or we can keep going. So this might be the time for any of you who might have questions to post them in the chat, and I will go through the pre-submitted questions first. So number 1, what are the best foods that contribute to fix or absorb calcium in our bodies? I eat other foods, not necessarily calcium-rich foods, especially for bodies having difficulty to absorb the mineral.
Okay, so we don't have specific food to help absorption of the calcium other than vitamin D, so those two goes well together. But the best time to eat to have the calcium is with your meals, because when you're gonna produce the acid to like all the digestion process, the acid's environment is gonna help the absorption of the calcium. So we actually recommend, if you're having let's say 1,000 milligrams, we don't recommend, like there's like a tolerance for calcium absorption. It usually goes until 600 milligrams. So that's why capsules, they come usually in 500 milligrams, and we recommend to have, let's say if you have a doses of 1,000 or 1,500, just don't go with one doses at the same time. Just divide it and try to have max 600 per meal. So we recommend 500, 500, 500. That way you're gonna guarantee that the absorption is better. If you have the 1,000 ones at a time, there's gonna be a little bit of 400 that you're gonna be losing, because the absorption is not gonna be that effective. So just make sure you have it with your meals. And if you're having at the same time vitamin D, it might help. If you don't need to have vitamin D supplements, I mean, you don't need to take it just for that. But usually when they do the supplementation, is because you're missing the food that is high on vitamin D and calcium, and it might be worth it to take both of them.
Okay. Next question. When taking calcium 500 milligram a day tablets, what are the best strategies, like a food combination, suggested time for dose intake, to avoid constipation and digestive related effects? Can they be combined with vitamin D, or should they be taken separately?
Again, it's a little bit the same question, so make sure you have it with meal. For the constipation, listen, you can fight constipation with a high fiber diet. You can fight constipation when you have high fiber. Just make sure you drink enough liquids, because if you have too much fiber and you don't have liquids, you're gonna just make it worse. And make sure you move. So those are the 3 factors related to diets that may improve constipation. If just by the secondary effects of the medication you're still constipated, you're probably gonna need the use of laxative, but you can try those like nutrition related strategies to try to improve the constipation.
Okay, thank you. I have 2 more that were pre-submitted. Are there any risks in taking too much calcium, like taking more than 1,000 milligrams if you're younger than 50?
It's very rare to have hypercalcemia from excess of calcium. Like I said, you can even go to 1,500, and it's considered a normal doses. However, it's rare to see it in breast cancer, but there's another type of cancers that increases calcium like by themselves in the body. So if you have a hypercalcemia related to the cancer, it might be not a good idea to have like the higher, the maximum doses of calcium as well.
Okay. There was one more that I got in French. I think you've already answered it, but just to make sure. Ayant un début d'ostéoporose, c'est un sujet qui m'interpelle. Je veux trouver des moyens d'augmenter mon apport de calcium par la nourriture au maximum.
OK. Ben, je vais répondre en français juste parce que je ne sais pas si la personne qui l'a posé n'est pas anglais. Si jamais tu as des doutes que tu pompes pour tes besoins en calcium, tu peux toujours avoir une supplémentation. Et normalement, les médecins, quand ils donnent des hormones, des thérapies hormonales de remplacement, ils vont prescrire le calcium. Dans le site web des Bone Health des Hope and Cope, tu vas trouver, on a fait, c'est un collègue, c'est pas moi qui l'a fait, mais un collègue qui a développé un matériel où il y a une liste des aliments qui sont élevés en calcium. Les aliments végétaux et animaux, si jamais il y a quelqu'un qui veut suivre une diète végétarienne. Donc, tu peux juste tout le temps, si tu es sûr que tu ne les trouves pas par ton alimentation, va chercher la supplémentation. Encore une fois, l'alcool, laisse-les au minimum. La quantité d'alcool recommandée, c'est pour les femmes, c'est un drink comme un verre. Ça pourrait être 150 ml de vin ou 30 ml de n'importe quelle boisson spiritueuse par jour. Et ce n'est pas accumulatif. Alors, si tu as prévu toute la semaine, il ne faut pas... OK, j'ai eu la réponse. So, it's not accumulative. So, if you didn't have your glass every week, it doesn't mean that the weekend, every day, sorry, it doesn't mean that the weekend you're going to have 5 glasses of drink per day. So this is proven to reduce the calcium absorption and also the caffeine. The caffeine, like cola drinks, like Coca-Cola or any other color drink, and the coffee and tea that has caffeine, it also decreases the absorption of calcium.
Okay. So thank you.
Okay, I have a few on the chat.
I had a couple also. There was one that was submitted like early on.
Okay.
If we are under tamoxifen treatment, should we expect any problem or side effect on bones? And if so, when, since treatment is for at least 5 years? And do we need to do some kind of control test?
It's not as aggressive as when we do hormone therapy replacement. But yes, all the chemotherapy treatment and radiotherapy treatment, they do increase a little bit the risk of osteoporosis. So when we talk about bone health, I would say like every cancer patient, every breast cancer patient should be take it personal. Like I said, the risk is going to be a little bit higher when you're hormone therapy because you have the inside factor that is not protecting you. However, chemotherapy, radiotherapy are very, very invasive and destroying treatment. So yes, you should just take the same precautions.
Okay. Yes, so I see a few other questions in the
chat, right?
Chat. So go ahead if you want to read them out.
Okay, could you please talk about tamoxifen treatment and bone effects? So we said it. Mm-hmm. Does dairy food cause inflammation? Not per se if you don't have any lactose, like any dairy products intolerance or allergies. However, again, consider when we have dairy products that dairy products are animal source and that they have fats with them. So when you're going to take dairy products, the kind of fat is saturated. So try to go for the lower percentage of fat. 0 to 2% are the recommendations. Like I said, it doesn't cause inflammation itself.
Okay.
Thank you. And when I go off hormone therapy, I'll be late 33. Do my bones go back to normal? Yes, they do, but it takes time. Again, when we do have that that switch in the metabolism, is harder to go back in track. When we do have reduced metabolism, when we do have a little bit of the changes of the compositions in terms of muscle mass and fat mass. This is in terms of like body changes. Do my bone goes back to normal if you're having the good supplementation in terms of calcium, if you're having proper nutrition, and if you're having exercise that might help to strengthen your bone mass. Yes, it might go back to normal. However, you're still like, after, let's say you're 40, then you have only like 8 years until you have again like the normal changes on your body due to menopause.
Okay.
Senna tea as a laxative. I must say that I don't know Senna tea, sorry. So I can just find out, I can just get the properties of the Senna tea, and I can just send an email to Carly and come back to you with that answer, because I don't know it. I have strong estrogen positive. My doctor told me not to eat soy and flaxseed. So is a very old recommendation. If I can also send to Carly the new recommendations in terms of American and Canadian Association of Dietetics.
Mm-hmm.
We do recommend, again, we have found benefits from the protective effect from the soy and the flaxseed. And back in the days, we used to prohibit because we didn't know exactly what was happening. So probably your doctor has like an old information. And the other thing, remember that nutrition is a changing science. So whatever recommendation is today doesn't mean that it's going to be the recommendation for tomorrow. I always say that when patients ask for intermittent fasting, ketogenic diet, this is things that, yes, that have been studies and that has been some positive effects, not for everybody, but we don't have enough to make it a recommendation. So, and usually to make a recommendation, it takes years, many years of studies, more than 5. So usually whatever is being studied today, it's going to be, if there's any heavy science to prove it, it's going to be approved or be given as a recommendation from here to 5-10 years. And maybe 10 years, what we were saying today is not really the case. So this is why we have to keep continue all the time with the reading, with the new studies, with the science, because sometimes it's even hard to catch up. Comment améliorer la flore intestinale pour diminuer l'inflammation? So if you're not with chemotherapy, you can go, well, everybody can go with high fiber diet, again, mix it with good hydration, because it's not, if not, it's going to make it worse. But you can go with probiotics or a soluble fiber. The probiotics are sold. You can go with Metamucil, but if you're undergoing chemotherapy, don't go there, because then your immune system is depressed, and probiotics are live bacteria, so we don't want to make things worse or increase the risk of infection. But something intestinal is just a high fiber, especially soluble fiber. What would be a maximum dose for coffee per day? It depends how big and how strong are your coffees. It go for caffeine, but 3 regular cups, and when I say regular, 250 ml per day, which like a medium coffee, it's okay. We don't have maximum really dose, depending of the side effects. Like there's a lot of people with excess caffeine, they have like a stronger, or they're gonna just change their heart rate, or they're gonna have sleeping effects, but there's no maximum. If you're talking about absorption for the calcium, just try not to go over 2 cups per day, and try not to drink it at the same time that the calcium. Senocot, the laxative has Sena it. Not sure if that helps. No, it doesn't. Sorry. I'm gonna just again read the properties because Senocot is a very like a doctor medication, which of course I know, and I know it's a laxative, but I really don't know the properties of the ingredients. So I'll promise I'll look into it and I'll send it to Carly. Is it safe to take Biochain gummies? Yes, it's safe. There's no contraindication of the Biochain. Usually all the hydrosoluble vitamins are, and that means that they absorb with water. Every excess, we just pee them. So we take them out by urine. So it's very rare to have like toxicities from the Biochain gummies. However, again, if you're having a variety of fruit and vegetables, I wouldn't say you need Biochain gummies. But yeah, there's no secondary effects on that. Strong espresso, I guess this is related to the first question about the how much quantity of coffee. So to be safe, strong espressos, I would say 2 per day. Can you give example of soluble fiber? Yes. If you see ingredients, pectin is a soluble fiber. So you're gonna find in the skin of fruits. For example, the skin of pears, the skin of apples. You're gonna find it on the oatmeal. Yeah, you can find it on the flax seeds. Yes. Pretty much those are the most common soluble fiber. When we talk about soluble fiber itself, if you go for beans, let's say in terms of diet or fruit and vegetable, you're going to have a mix of soluble and insoluble. But if you want to go for straight and let's say isolated soluble fiber, you're going to find the skin, like I said, pear, apple. You're going to find it in the oatmeal, and you're going to find in flaxseed. And you can have it, the metamucil actually is soluble fiber as well. And I think I'm
Is that
done
it for
with my
questions? Okay. I have one more question for you, actually, just for people who don't necessarily know about how a dietitian might get involved in an oncology case. So can you explain like how patients would come to see you or someone like you at another hospital?
So I'm going to tell you in general my practice at the hospital. So we are very autonomous in our practice. We do receive consults for doctors. So whoever is either having trouble eating because of the secondary effects of the chemotherapy, whoever is having maybe alteration on the labs, let's say high blood sugar, let's say hypercholesterolemia or diabetes, they're going to consult. We're very much really implicated in hospital in terms of malnutrition. So a lot of patients that either for the disease or for the, again, medication, they stop eating and they're losing weight, and it's really like a visible issue. Like I said, we're very autonomous. So we have a screening system in the hospital. So whoever we consider that might benefit from either teaching or an intervention because something is very bad, we're gonna go in without asking anybody to go in for the patient benefit. On the oncology clinic, now times of COVID, the dietitian is not present there, but we do have an office in the oncology clinic that usually is like a walk-in. So dietitian, again, she mobilizes herself to go to see patients receiving chemotherapy to make sure that everything is going well with nutrition, they don't have questions, but patients also come into their office to ask questions or to inform that they want a dietitian. We also receive consults. For the ones of you having chemotherapy and radiotherapy, active treatment, dietitian is available. Unfortunately, for those of you not having chemo or radiotherapy, there's no service. We can always make an exception if you like, if you get a consult and we're like you're really interested for some reason, but usually we focus because we have a lot of patients. So we focus on patients that are really having active treatment and active secondary effects.
Okay. Well, I'm seeing something come up in the chat.
Hold on, I have another question. Is it clear for my implication or implication with
So if a patient wanted to see you, they would ask maybe to be referred to you? Or?
They would ask to be referred. Like I said, for now, it's better to ask. It doesn't have to be the doctor. The nurses can refer. Okay. And in a normal time, you can just drop by the dietitian's office. However, the dietitian is working from home right now, like the dietitian from the outpatient clinic. And we, the inpatient, we take care only of the patients that are admitted to the hospital.
Okay.
So, but yes, you can request if you're having treatment, you can request your nurse, and they're gonna just give them a call to the dietitian, and they're gonna refer, and the dietitian is gonna contact you.
So ask
so I have a question here. Mm-hmm. One of my liver enzymes is always high because of chemotherapy. What food can I eat to help my liver? Yes, so usually the main thing that you have to do for liver is just try to go with a low-fat diet. Usually the fat is mainly, like, everything digests and processed in the liver, but the fat, let's say you're the heaviest one, all the biliary tree, it has to produce substances for the digestion to happen. So we recommend to just a low-fat diet. If you can keep it a little bit low in sugar, added sugar as well, it wouldn't be a bad idea.
Okay. I think that's it. Yamileth, I want to thank you so much.
I want to thank you.
Mm-hmm. I think, like, it's always so nice to hear the different things that, you know, you have to say, and the different, you know, and bringing, especially when you bring in the newest research and the newer recommendations, it's really great to have you. And I think I would probably hear that from all the patients. I'm getting a lot of thanks for the information kinds of things in the chat right now. So I'll let you all go now. I'll say good evening. This will be, like I said, recorded, and we will share it in our next Hope and Cope Communicate to patients.
I just want to say that it's a pleasure to be here.
Thank you so much.
I come back for the Senna tea, okay?
You what?
I will come back with the Senna tea.
Okay, sounds